Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our Plática called Take Action LA. With me today is our esteemed co-host, Ana Chavez Mancias, NALBA Program Director. She'll be introducing herself shortly. NALBA is a nonprofit organization dedicated to the well-being of Latinos, their families, and communities across the United States. Our mission is to address the great disparities and barriers that affect the behavioral health of Latinos. Today, we're excited to present our Pláticas series called Take Action LA County on reducing stigma and connecting community health resources to help individuals access help and recovery. Plática is the Spanish word for conversation. So we're going to have a great conversation today with our presenter as well as my co-host, Ana Chavez Mancias. Today, we're going to highlight the work of our guest speaker and the services that they provide to the individuals and families in Los Angeles County. So NALBA would like to thank the County of Los Angeles Mental Health Services Department for making this series possible. Each week through June of 2023, NALBA will host speakers who themselves are directly involved in mental health services to share their stories, talk about their outreach services, and what resources they make available to the residents in LA County. Please join us every week as we present this series of conversations on how to start your road to wellness and learn about the resources available to you to help you on that journey. So let's begin with our co-host, Ana Chavez Mancias, who will introduce herself and our wonderful presenter. And of course, more importantly, we'd like Ana to be able to say a little bit more about herself. So Ana, go ahead.
Thank you, Fred. Hello, everyone. Again, my name is Ana Chavez Mancias, and I am the Program Director for the National Latino Behavioral Health Association here in Los Angeles area. I live out here in the beautiful city of San Dimas. Prior to my work with NALBA, I worked for Pacific Clinics for over 19 years, providing bicultural and bilingual mental health services and substance abuse services to families, children, and youth. Now, allow me to introduce our wonderful guest. I am super excited to have him here today, Alejandro Chavez. He was born in Los Angeles and raised in the city of Altadena, California. He has always grown up with the idea that you have to love what you do and do it with love. He has worked in the field of HIV for over 15 years in different capacities. And this is the kind of work that he's passionate about. Currently, he is supervising biomedical HIV prevention efforts at AltaMed Health Services, one of the largest QHCs in the US, with projects funded by the State Office of AIDS, SOA, HRSA, and the Los Angeles County Public Health Department, focusing on PEP, PrEP access, navigation, and HIV testing. Welcome, Alejandro. And we're so happy to have you here joining us for this Plática.
It's a pleasure, un placer. Thank you for having me here.
Well, it's an exciting time to kind of learn about the work you do, the community you serve, and how we can connect people to your organization. So we're going to want to get started here, but more importantly is as we have live Facebook audience members asking questions or comments, Alejandro, we're going to share those with you. But let's start by having you introduce yourself, say a little bit more about who you are, and let's have folks get to know you here in this wonderful space that we're in with you today. So why don't you go ahead, sir?
Yeah, absolutely. So my name is Alejandro Chavez. I also go by Alex. No relation to Ana. No somos primos. We're not cousins or anything. I am... we may be somewhere along the lines. Uno nunca sabe. One never knows. But I am born here in LA, raised in Altadena, which is near the Pasadena area. And I've been doing the work of HIV for over 15 years now. I've been at AltaMed Health Services specifically going on 6 years. But I essentially work with La Comunidad, the community as a whole, youth, family, older patients that we have. There isn't necessarily just like one specific patient that we target the community as a whole, because everyone would benefit from the services that we do here at AltaMed. So specifically in the role that I do, I really focus on HIV prevention, sexual reproductive health issues for men and women, STI or STD prevention. And that's really my main focus here at AltaMed. And again, it's a passion project for me. It's something that I absolutely love doing. So again, it's a pleasure to be here and to be with y'all.
Well, I can tell you're excited about the work you do. And for 15 years, that means you've been very dedicated to ensuring that individuals in your community have access to the wonderful information, education, and other services that you render there. So if you're going to say what you're most passionate about in your work, what would you say that is?
You know, I think about this work in a couple different capacities. Yes, I'm getting paid to do the work, but I'm also getting paid in something I call heart money. And to me, what that means is helping someone in the community really means a lot to me, even if it's just a little bit, right? Even if they're just able to say, I learned today how HIV is transmitted, and I will be able to take that with me for the rest of my life. That is more than gratifying in itself, because essentially I've equipped someone to have information in their tool belt to help them along their journey of what sexual reproductive health is, what sexuality is. So for me, I think that that's why it's so important. I do the work because I'm rewarded in a way that money doesn't reward me. And it's really helping my community and seeing the change, because in the 15 years that I've been in this field, I feel like I have been able to change people's lives, or maybe perspectives, or maybe I taught them that one little thing that they were able to take to other people and share that knowledge. So for me, it's really rewarding work in that sense. So heart money is what I call it.
Ah, got it. Well, it's a new currency, so I guess that means you can spend as much of it or circulate as much of it as you can. So, Alejandro, thanks so much. And we're going to ask Ana now to kick us off with the rest of the questions.
Thank you, Fred. Wow, I love that concept, Alejandro. Heart money. That's really that's the meat of the work that direct service providers do, right? So I love that concept. Thank you for sharing that with us today. So to move on with our Plática today, why don't you tell us a little bit, tell our listening audience and those watching today about the services, all the services that you provide and that are provided by your organization, and what population are you serving currently?
Yeah, so maybe a little background. So again, I work for AltaMed Health Services, and we're one of the largest federally qualified health centers in the West Coast, if not in the nation. We have approximately 39 different clinical locations spread out from Los Angeles all the way down to Orange County, into Orange County. We have 9 pharmacies that we work with that are all AltaMed pharmacies. And again, we really focus our overall work within the community. So people who are underinsured, not insured, undocumented individuals, that's really the communities that we focus on and where we're located. Currently, I'm in my office in Boyle Heights. And so again, we're really centralizing the communities that need more access to healthcare, and we're the people to do it. And not only do we do healthcare, we do dental. Not only do we do dental, but we do our senior services, which is our PACE department. So you might see our little AltaMed trucks on the freeway or on the streets, and they're literally picking up our older populations and taking them to appointments or to our senior centers. So we really do a little bit of everything. We have our women's health. We have the department that I'm in is specifically HIV prevention. So I can really focus on what we do here in my department overall. But we offer everything from group level interventions for young individuals who are navigating what sexuality is. So maybe they are in the LGBT queer spectrum and they don't necessarily have services, don't know where to talk about this, don't know what it means. So we have a drop-in center here in Boyle Heights where anyone can come in and really talk to individuals who work here. We offer free HIV testing here. without an appointment, no insurance needed, and you get your results in 2 minutes. So literally anyone can walk in and say, hey, you know, I'd like to do an HIV test, whether it's their first time doing it or they come often because they take care of their sexual health. We see them on site, and it's an experience for a lot of people, because a lot of people don't necessarily think about, well, I need to take an HIV test today, even though they're sexually active. As we know, HIV has historically been seen as a gay man's disease. But working in this field, we know that's otherwise. We have women who are infected. We have men who are infected. We have infants who have been infected neonatally, or prenatally. So there's a spectrum of who we serve here. We don't only do the HIV prevention side of it, the preventative side of it. We also do the HIV care side of it. So, for instance, if someone comes into our locations and they receive an HIV test, and that HIV test happens to come back positive, we're able to link them into medical care to get them into treatment. Because what we know from this is that HIV is not a end all tell all. That's not the end for anyone. It's really something that is manageable and you can live with. And you know, again, we're in the business of educating the community. And I don't know if y'all are familiar, but there's a messaging out there that is you, the letter U equals you. And what that means is, if you're undetectable, you're untransmissible. So someone living with HIV under treatment, depending on how well their treatment is going, if they can get to a level where their viral load is undetectable, they can no longer transmit HIV to someone else. And so really the care is always on the preventative side, even though someone may be living with HIV. And I know that we talked about, you know, this is really based on stigma. And I know we'll talk a little bit more about that. But there is a lot of stigma that is surrounded by someone who's living with HIV. There's a lot of stigma surrounding sex in general, sexual reproductive health in general. So when we're not talking about these things, or we're not sharing these messages, we are really doing ourselves a disservice, because we should be talking about these. We should be normalizing this. If we can normalize it, we can take the stigma away, I believe. So
Absolutely. I think you're absolutely right with that, you know, and the one fact that just stood out to me on everything that you shared with us is like 2 minutes. I mean, 2 minutes. I remember when taking an HIV test, when the whole thing with HIV kind of blew out, it would take like a week or longer to get your results. You know, was it 2 weeks? Yeah, I remember that. I mean, it's incredible. Now within 2 minutes, you're able to get those resuls. I mean,
yeah, but I'm sorry, go ahead.
I was just gonna say that's amazing. I mean, I think that's great.
Yeah, and I think the thing with that is, which again adds that layer of stigma and fear, is that, like, if you think about it, in 2 minutes, your life could change, right? In one way or another, whether your test result comes back negative, what does that change? Like, does that alter then your behaviors so that you don't put yourself in that predicament again to be like, oh my gosh, am I, you know, or does it change in the sense of, okay, well, now I'm living positively and I need to do XYZ to make sure that I'm taking care of myself. So again, the stigma goes both ways.
Right, absolutely. And then, you know, also the fact on what you said that, you know, HIV really, much like many other of the mental health problems that we, you know, or other illnesses or other disease that we live with, you know, which include like mental health and even like addiction, substance abuse, you know, it doesn't, it's not for a specific group of people. Right? It can impact anybody. It doesn't care whether you're rich, whether you're poor, whether you're male, whether you're female, if you're a child, if you're an infant, you know, it has no respect for anybody, really, you know, and it can happen to anybody. So these great services that you're providing are for an entire community, you know, for an entire community. So thank you for sharing that. That is such great information. Thank you.
No, absolutely. And I think for those of y'all who are watching, and even you, Anna and Fred, like, I bet that if you were to pose the question to your friends or your close, like, circle of people, like, when was the last time you had an HIV test? A lot of people would say, oh, I don't know. It's been so long. Or the common response is also like, oh, pues I'm married, and that's great. Like I'm not judging the sanctity of marriage and what that's like, but it's also one of those things where like we should be in charge of our sexual health, right? And we should normalize getting certain checkups. If pap smears and mammograms are normal, why aren't HIV and STI panels normal?
Right.
So I think it's really about normalizing that. Even if you're in a relationship, having that common ground of, you know, I'm not, now that you and I are dating, let's make sure that every 6 months you and I go get an HIV test and an STI test together. And maybe that makes our relationship stronger because we're doing this together and we're no longer alone. So even small things like that to just change the way we think about like the stigmas behind it, because someone wants to go get an HIV test doesn't mean they're being promiscuous or having all these partners. It doesn't mean that. It just means that they want to take responsibility of their health. And that's what we should be encouraging. Like we want people to take responsibility of their health, want to care about their health. And I mentioned this earlier, if it's not falling off or if it's not, you know, bleeding out, then I'm okay. But
Right.
we should be talking about preventative
Right.
health as well. So
It's all about prevention, I think, particularly in our Latino community. And I'm sure it's probably similar in other cultures, but like you're saying, unless it's falling off, or unless it's broken, or, you know, unless something is really happening, we try to steer away even from the doctor's office, right? You know, like, just like when it comes to mental health problems, right? We steer away from the mental health clinic because no estamos locos, we're not crazy, you know. So it's pretty similar. It kind of it crosses over, right? Those thought patterns, those cultural things that we have ingrained in us, right?
yeah, absolutely. I think culturally, you know, and again, being in this work for so many years, it's not just our Latino, you know, my Latino family. It's a lot of other cultures. And again, I think that what we have forgotten is that sex and sexuality is a human trait. Like it's a normal thing. And yes, some people engage in sex and some people don't, and that's fine. But I think it's becomes dangerous when we don't want to talk about it anymore, or we're too ashamed to talk about it, or the stigma is if I'm asking you questions, then I'm going to do the things. So if I'm asking you about condoms, then I'm going to go out and going to be using condoms, which is I'm like, great, you're out using condoms. That's great. But for some people, they think that that's encouraging the behavior. So,
Right, when we're just wanting to keep people safe, right?
or give people the tools to make the correct options, right, for themselves. I think that the more we know about things, the better we can make decisions about how we deal with them, how we treat them, how we seek the healthcare. You know, the other thing is, if I go to the doctor and I don't have insurance, I mean, I have to pay for it. And that's not the case. Here at AltaMed, that's one of the things that we want to eradicate. We don't want people to have the fear of, oh no, because I need medical help, I can't pay for it and I can't afford it. Then we have programs, we have all sorts of programs, especially here on our prevention side. There are medications, and one of them you read out, it's called PrEP, PrEP, and it's a pill that you would take almost like birth control to prevent HIV from happening. So you take a pill every day, and it prevents HIV from happening up to 99% if it's taken correctly. So that's another thing. Like a lot of people don't know that these things are available because we're too afraid to talk about them. And so even just mentioning that, like, and we offer that for free here at AltaMed. That's the program that I run. Like, so I can have someone reach out to us on our Instagram, because we use a lot of Instagram posts, a lot of social media education on Instagram. And we have pharmacies that people can walk into without an appointment and say, hey, I need this medication. And a lot of the barriers are, like, for health organizations is, I don't have any appointments. You can't be a walk-in, you have to have an appointment. And we want to eliminate that. We want to cut that. We're like, no, si están preguntando, if someone's asking for this, we want to be able to give them the access to it. And so we're working on rolling out this medication at all of our pharmacies, that if somebody wants to walk in and say, I want to protect myself from HIV using a medication, can I access that? The answer is going to be yes. and at zero to no cost. If it's up to us, we'll get it for free completely using programs, assistance from the government, the pharmaceutical companies. But we want to make sure that people have access to these things for free. Anyone.
Absolutely. And I think it's so important. I'm so glad that you're talking about this here at our Plática today, because I think it's important that to get the information out, right? I think that's like probably, I would say like 99%, right? We get the information out. Like I personally didn't know that this pill existed, right? So I'm learning something new from you today. And I did not realize also that AltaMed has these programs that, it's services for the uninsured. I mean, especially, out here in California, we have people that, are undocumented, don't have papers, so therefore they have no insurance, right? They are uninsured or underinsured, and that we have such great services out here available to them at zero to no cost, like you said, so that is so wonderful. And again, I think it's about getting the information out, and that's part of what we're wanting to do with our Pláticas here with Take Action LA, right? To get information out so that the communities are aware that this is available, that, that there are little to no barriers to getting access to this, whether it's medication or these services, right? So that is excellent. Thank you for sharing all of that with us, Alejandro.
I mean, now that you say that, like the fact that you just learned that, again, heart money right there. For me, that's like, aquí cayó el 20. This is where it clicks, right? And now Ana can say, I learned something really interesting today in a plática, that did you know that there's a pill out there that helps you prevent HIV from happening? Because I didn't know that. And a lot of people will say, I had no idea. And some of the issues that we've kind of run into is that it's also not marketed to everyone. Again, HIV's unfortunately is still very painted gay, like it's a gay people's disease. And so a lot of the marketing that is out there really doesn't focus on women, youth, or the older populations. It really just focuses on queer men or queer identifying individuals. And so it's my job to say, no, this can be for anyone who's really sexually active can benefit from this. All right, and I'm going to spin it one more for you. There's also a pill called PEP, PEP, and that is it's like the morning after. For instance, you have a sexual encounter with someone and the condom accidentally breaks, but you don't know the HIV status of your partner. You can go into one of my pharmacies and say, hey, I had this accident, and you have up to 72 hours to access this medication for it to prevent HIV from happening. So even then, we're able to help on that side as well. So yes, you can do it as a preventative, but you can also do it as oh my gosh, this happened to me. We know that accidents happen. So we want to make sure we're covering on both ends, and we can do that. So one is PrEP, to get prepared, and one is PEP, the post. So
wow, what great information you're sharing with us today, Alejandro. Thank you for that.
Claro.
All of our communities and people watching now and people that will watch this video later are going to benefit from all this great information. Don't you agree, Fred?
Oh gosh, darn. Well, it makes you appreciate that with that many number of clinics in that geographic area, that means the service is available. So that's a great thing, right? It's one of the healthcare domains, right? I want to have you talk a little bit about accessing the services, right? And tell us and walk us through what that would look like. Tell us about kind of all the different methods people can access the service, and then maybe give us an example of what that looks like. A successful connection between services, person seeking help, and getting help. So give us an example of that, because here it is, right? AltaMed, right? I remember driving through Los Angeles and seeing that signage everywhere. And then I would say to myself, I wonder what they do there, right? Because I'm driving by, I'm not in California, not from California, but it caught my attention, right? So kind of walk us through what that experience would look like for somebody who does access your services, and kind of share that with our listening audience so that this way people can know how to access your services.
Yeah, absolutely. So there's a couple different entry points. I think our most successful entry points is when we're out in the community. So one of the things that my team does, and my department as a whole, or our department as a whole, is we go into the community to provide services. So maybe not the medical services, not the full spectrum of it, but we really do the educational components. So we go into places like homeless shelters for youth. We go into locations like LACCNP, the network providers. We do work with schools, charter schools. We do work with substance use treatment centers. And we go in there, we do the educational piece. So the first off is we talk about HIV. This is how it's transmitted. This is how you can get it. This is how it's tested for. And then what happens is people are like, oh, wow, like maybe I should get tested because I've done some of these things, or I've come in contact with some of those body fluids. So maybe now I can ask them. And so usually it's a lot of, where are your sites? Where can I go? From person to person, right? And then we direct individuals to our locations. Oh, we're down the street, or here's a flyer. You can do it this way. So that's one of the ways. Outreach in the community, we're really big at it. So if anyone listening would like us to come out and do outreach at a table, or wants to present to staff or their community members, youth, whatever it is, for an educational session, you can always reach out to us. I'm sure we'll share information, my personal information and whatnot, but you can reach out directly to me that way. But again, also we do a lot of social media education. We know that nowadays people don't have the time to necessarily go to a Plática in person, right? Which is why we're doing this Plática virtually. And people watch these because they can watch them either live or once they're recorded, and it just stays there. And so we always offer up our services. We always guide people to our social media pages. If you want to learn more information, you can follow us at www.altamed.org. You can go to our Instagram, which is Grow Proud. One word, Grow Proud. And we talk about all our services there. As a matter of fact, while I'm on this live right now, I have a team doing a live about monkeypox vaccinations and the importance of it, because again, that goes hand in hand with sexual reproductive health. So we're constantly in the community really talking about the things that we're doing and how to access us. So that's another entry point. A completely new one, or a completely different one, would be calling our call center. You saw our bus on the side of the freeway and you got the number, and you were interested in getting your medical care through us there. So we have people who would guide you and let you know, hey, yes, we accept this insurance. Oh, you don't have insurance? We can help you get this insurance. And so we have a call center that takes care of all of that, specific for medical side. For the HIV care and preventative side, we are more hands-on with that. So there's not just one single point of access to us. There's multiple. So again, we want to eliminate barriers to the community. We want to provide access points. So going into a pharmacy for some of our HIV preventative stuff, easy peasy.
Awesome. Well, it's nice to know that, you're trying to eliminate the barriers or the challenges of how to get services, right? And then you also have service capacity to do this, and not just in English, but probably other languages. And so, because access to services comes through the language portal, right? In other words, I'm gonna take my grandpa for services, pero le gusta hablar en español. He prefers speaking in Spanish, right? So what's going to happen is, here goes the grandson and the grandfather, van juntos. Pero sabes que, guess what? Grandfather's going to want to talk in Spanish, right? But the grandson is a conduit, right? They're kind of a cultural broker for grandpa, right? But the language access of that is very unique. So say something about that. It'd be good for our listening audience to know about the language access to those services.
Yeah, I mean, I can tie this ties into home. I mean, my parents are los dos son from Mexico, and so growing up, I'm an only child. So growing up, I was a translating machine. I didn't know half the things that I was talking about. You're talking to a 7-year-old kid trying to translate medical jargon, that is a very difficult, because I mean, and it's unfortunate that, yes, although Spanish is prevalent in California, the translation from English to Spanish isn't always clear for those who don't have Spanish as their first language. So that's one thing. Secondly, I want to feel comfortable talking to my provider in the language that I understand and I feel comfortable speaking to you in. So, here at AltaMed, um, we really do encompass the Latinidad of our community. A lot of our providers speak Spanish, but we also have translation services because we know that not just Latinos come and see us. It's a little bit of everyone. And we have providers who, not all of them speak Spanish. And so we do have translation services so that we don't have to have the grandson there doing the translation. They can still be there for support. We don't mind that. But the translation services really should be coming from us. And we want to make sure that our translation services are not understandable. They have to be understandable to everyone. And so we really try to make sure that our translation services are really specific to the communities we serve and in the language that they're going to understand. So that's super important for us here at AltaMed. I think that in order to have great health care and great results, you have to meet the community where they are. And that's really essentially what we're doing here at AltaMed, is really meeting the community where they are and trying to provide access points for anyone and everyone.
That's excellent. Well, and you're absolutely right? So if you have bilingual staff, that's great. If you don't, then you have trained and qualified interpreters to help with that situation, because when the person walks in, that very moment in time, that person is ready to get help and to be able to avail themselves to the services you offer. So the timing of it's critical, right? So you don't push the person out saying, well, you'll have to come back in 2-3 days or 2-3 weeks, because guess what? Grandpa has been thinking about coming in for a time, and that day he walked into the clinic. Didn't make the appointment. He didn't go on a portal. He walked in porque ya estaba listo. He was ready, right? He wanted to go and now take care of, the things that he needed to attend to. So, well, Ana, it looks like we also have, a couple of other questions we want to ask Alejandro too. So let's keep moving here, because all I can tell you is Alejandro's just a wealth of information, and so let's not stop here. So you probably have another set of questions for him.
Absolutely, Fred. Before we move to the next question, I just wanted to read a comment here about on our chat. It says, minor consent laws in California allow young people age 12 and over to consent to certain services without parental or guardian involvement. And AltaMed assists youth when receiving services. So that's also a great fact, to share with our listening audience. So thank you for that, Elizabeth, for sharing that comment with us, because that's also important for our listening community and those watching today, right? So I think, Alejandro, would you be able to elaborate a little bit? You talked about how our community can access the services and the different service, the points of access that you have at AltaMed to access the services. But could you give our listening audience an example of a client or a family that you had that you helped here in Los Angeles, and what the outcome to that was?
Yeah, so I want to, if you don't mind, Anna, I would like to just mention what the comment that you made beforehand as far as the consent. We for sexual, reproductive, and mental health services, yes, a child can access those without consent from an adult, and I know that is. It's a little double-edged sword on this, because we would hope that our young children would feel comfortable, or youth would feel comfortable coming to us as adults or parents or guardians with these things. But again, this ties back into the stigma and the shame that is sometimes attached to, what, I did this and I know I shouldn't have done it because I'm young, or whatever the reason is, but I don't want to tell you because I'm gonna get in trouble. And I think that there's so many things that we would avoid, again, if we would only just feel comfortable enough talking about these things openly. No one's perfect, or I don't think anyone's perfect. And so just opening that space to say, hey, if you ever need these services, you can go and get them without me. But I want to make sure that I'm also opening that door for you to speak to me about these things without having judgment from me as your guardian or parent or adult. And so just having that little bit of information. But yeah, we have had quite a few successes, I think, in our work on many levels. Again, we do a lot of HIV testing out in the community. And so our work with LACCNP has been amazing. We go there for two things. We go there to do educational work with their youth. We've also done educational work with their adults. And so our idea is if we can teach the adults and we can teach the youth and they have questions, they can go back and forth with each other and discuss, right? So that's our first thought. Our second thought is, again, like I said earlier, if we discuss the things that cause HIV to spread or STIs to spread, maybe people will realize, oh, you know what, I should get a test. And so we've been able to go to LACCNP and provide quite a few HIV tests there for the community, over 200 tests. But just because they get tested for HIV doesn't mean we don't mention our other services. So sometimes it's, we have providers we have a doctor's office that's right around the corner from where you live, based on our conversation with patients. And so their idea is, well, maybe I can access services there because it's closer to home. It's easier for me to get there because I don't drive. So taking public transportation or walking is a better option for me. So I would say we've had plenty of success in that sense. We've also had plenty of success in someone who receives an HIV positive test. Again, we're here not to shame anyone, but we're really here to make sure that you're thriving in your health, whether that is living HIV positive or HIV negative. We want what's best for you and your health. And so we've had plenty of patients who have come in for HIV test and they receive a positive test, and we're able to link them into care and the next steps in their journey of having HIV or living with HIV. And Anna, you mentioned something earlier. It's like any other disease, right? I mean, someone who is diabetic has to get treatment, and it's an everyday, day by day thing, and you treat it. It may never go away, but you treat it. High cholesterol, things that the Latinos we really deal with quite often, diabetes, high blood pressure, high cholesterol, we treat them. And that's how we navigate through this. But we're here to help navigate that with you. No te dejamos solo. We don't leave you alone. We don't say, here are your results, go figure it out. No. We will go, we've even gone as far as attending your first medical visit with you if that's what you want, just to make sure that you're not in this journey or ride alone. We also have case managers who will be there side by side, just following your case and seeing what you need, whether it's medication, whether it's housing, whether it's mental health services. Again, a lot is changing for people when they first find out they're HIV positive. And so mental health is definitely something that we want to address when we're dealing with new patients.
Yeah, absolutely. That's an important thing to address because I'm sure there's a lot of things that happen, like if you find out that you're positive, right?
I mean, and the same with diabetes, right? If you just find out you're diabetic, what does that do to your mental health? Like, absolutely. I can't eat tortillas anymore. I can't have my pastel. Like, it changes a lot.
What am I gonna eat? Quiere que sea conejo. The doctor wants me to eat just veggies, right? And salads. ¿Qué voy a hacer? Right? It like really like disturbs our diet, right? So yeah, that's with anything. Absolutely, you're absolutely right with that.
and again, it's something that we don't always think about, like as part of it being our mental health, like how certain whether it's diseases or anything can affect our mental health in other perspectives. So. Yeah.
Fred, you want to take the next question?
Yeah, I was thinking to myself, we're in such a wonderful time in the healthcare and mental health industry. 50 years ago, this conversation wouldn't even have taken place. What's happening here, right? Because the societal norms and views about, these subject matters have changed over the course of time, but we're at a time now where this is common conversation. We do talk about these things at home or in the community in these pláticas, but now here's what we're also doing is not only just talking about what we need to do to take care of ourselves, but we're also confronting stigma. So I wanted you to kind of help us learn about the approaches you've used or the organization has used to really confront stigma, right? It's that thing that's there to really prevent us from getting help. It's that thing where people are using labels or stereotypes or describing us in ways that's inappropriate, right? So what we know is there's different ways to address stigma, you know, by confronting it very directly and helping people learn how else to rephrase things or to help inform them and educate them, or speaking with people as part of community conversations, right? In settings where you manage the conversation with folks who are going to be learning about this issue called stigma. So, say a little bit more about how AltaMed is helping address that.
Yeah, I mean, one of the biggest things that we know really affect our personal health, mental health, our physical health is stigma. Stigma blocks us from a lot of things. Accessing care is one of the biggest ones, right? If anyone sees me go into the therapist's office, run up and said I'm crazy, they're gonna think I'm crazy, so I can't do that. If anyone sees me walk into, for instance, a Planned Parenthood, they're going to think that I'm there for maybe an abortion or, whatever it is. And there's always this stigma around it. And one of the things that here at AltaMed, we try to do is create environments that are judgment free, right? Like we know that if a patient walks in and says, last night I had unprotected sex, that the provider is not going to be like, I'm sorry, you did what? Like I could fail. Like that's the one thing that we want to eliminate here, at least within our walls. Even outside of our walls, when we're out in the community, we want to make sure that we are creating an environment that's safe for anyone. There's a lot of people who use the term of a safe space. We like to use a brave space because it really takes a bravery to be able to open up. And a safe space can change in an instant. If someone else comes in, they can change how safety it feels for someone else. So we prefer to say a brave space. So we want to create brave spaces for individuals to be able to share what's important to them and their health, whether that's mental health, physical health, sexual health, it doesn't matter. We want to be able to create an environment where people feel okay having those conversations. We also don't want to force it down anyone's throat. We want to make sure that we mention the things, and if you're not comfortable talking about that, we're not going to pressure you to answer it. We will make sure that that we're the reason we're asking questions is because we want to make sure that we're treating you as a whole with everything that you're doing. We don't want to take away from. We want to make sure that you're living your best life based on what you are already doing, maybe just in a healthier manner. That's it. We're not here to change it. And I think a lot of times is, I know my cholesterol's low, I can't eat XYZ. And I think that's the automatic thing about it, right? Oh, I don't want him to get an STI. That means I have to be abstinent. And that's not necessarily the case. We want to, again, prepare you for, if you want to do these things, here's how to do it safe, a bit safer.
We realize that with the time that we have, how do we really kind of get some of the insights about the work you've been doing for these years, Alejandro, and we're gonna want to learn more about from you what people can really do to benefit from all of these services. And so, what's kind of your marketing approach to getting the word out and helping people really say, "Sabes qué? I'm going to take Alejandro's advice. He was encouraging us. He was telling us exactly what I have to do." And so then here comes tomorrow, right? You get that phone call or you get that text message or somebody goes to your website. I mean, what do you want to say to the LA community so that we can encourage people connecting to your services? What would you like to do to make that possible?
Yeah, definitely. I think one of my marketing ideas around this is we should all try things that are outside of our comfort zone in the essence of maybe I've never done an HIV test. But now that I heard Alejandro talk about it and like the importance of it and how I could, if I'm HIV positive, I can get treatment. If I'm HIV negative, I can be put on this pill to keep me HIV negative, as long as I'm on it. I think really what I would share with individuals is be open-minded about information. And I know that some of it may be a bit uncomfortable, and only because we're not used to talking about it openly. We're not used to talking about sex and sexual reproductive health and gender and sexuality. We're not used to talking about those things. Those are not normalized things. They're not normal in schools. They're not normal as adults. They're not normal for kids. It's not a normal thing. But I feel like we can start to eliminate those stigmas, those thoughts about things being bad if we're able to talk about them. So my piece is always ask the questions, even if they're a little uncomfortable. Ask the questions because you don't know unless you ask. And I know that it sounds so like duh. That's a duh moment, right? If you're not asking, but it's the truth. And I feel like a lot of the times it's we don't we don't feel the bravery enough to ask the questions because we don't want to feel like we're asking a dumb question, right? And to me, there's no such thing as a dumb question. The only question that's kind of silly is the one that's not asked, because I don't want to leave a plática like this with like, was dang, I didn't ask that one question that I should have asked. I want to leave saying, wow, I really asked all the questions that I wanted to, and I feel non-ashamed. And I think it's a lot of that. I think that those watching and listening, or those who will watch and listening, open those conversations to family members at home. Open these conversations to your friends. Maybe you start with your friends because you feel more comfortable with them, and talk about like, hey, Alejandro, when was the last time you had an HIV test? Or, I've never had an HIV test, and I've definitely been sexually active. So I wonder why my doctor's never recommended it. Like even that question, right? Why has my doctor never recommended this for me when I am sexually active? And then you may want to think about like, is that the right doctor for me? Because are they doing all the things are they taking me in as a whole? And so again, that's one of the things that here at AltaMed we really try to do is holistic care for the patients. Is we want to make sure that we know the things so we can treat you as a whole. So yeah,
That's wonderful. Well, I want to tell you that, for a moment there, you kind of reminded me of another way of how people get information, right? And that's through mass media and television particularly, right? So
yeah,
if you think about this, it's not uncommon for telenovelas, for instance, to talk about the subjects that oftentimes might be taboo, right? But here's what they're doing that's very influential is they're bringing up the subject about what is really happening in people's lives, what our constellation of family deals with on any given day, because those are the current realities.
yeah,
And what's different, of course, from telenovelas to pláticas, of course, is we want to always ensure that we know the advice that we're giving or the information we're sharing is based on fact or based on the science or it's based on the practice, right? All of us as professionals are ensuring that what we're doing is giving accurate, factual information. And so I want to say thank you, Alejandro, for really helping educate us, helping educate the community, and really putting such an honest face to these realities, right? Because oftentimes that's exactly what people do. They get influenced by the way you express things, by the way you're saying them, by the way that you're encouraging people. Because when it's about a person's well-being, very few people actually disagree with that. Because you know what our favorite phrase is as raza, right? The moment we see each other, the first question we ask, ¿Cómo estás? How
yeah,
are you?
yeah,
Right? We want to know how people are doing. We're just naturally gravitating to what it is that's important to all of us,
yeah.
and that's our personal well-being. So, Ana, here we are. Now we have to kind of hear what this takeaway is for Alejandro from today's plática, because I'm sure he's dying to say, well, these are the things I want to have people take away from today. But Ana, why don't you go ahead and bring us home before we kind of wrap up for today's plática?
Absolutely. So thank you so much, Alejandro. Like Fred was saying, we have learned so much from you today, all this great information. Our hope again is to get it out to our communities here in LA, and beyond, right? This information is power, right? Information gives us power. And not only that, but it will also help us reduce the stigma. The more information that we know, we start normalizing some of these things, right? And it's okay to go and have get tested for diabetes and to get tested, for high blood pressure. It's okay to go to the doctor. It's okay to go see the therapist. It's okay to, maybe I should be getting tested for HIV as well. I get a pap smear every year and they test me for STDs, all these things, it's important, right? So thank you for all that great information. But now I think we come to the $1 million question. I think that what we want to leave our listening and those watching our, listening audience and those watching us today is like, how can people reach you or reach your organization, your program there in Boyle Heights, where you're at? How can they come to to see you or see what some of your staff and access some of these great services that AltaMed is offering for our communities?
Yeah, definitely. You can always look us up on the web, on the internet. So altamed.org, very simple. Altamed.org. If you're more interested in the HIV services department, it's hiv.org/HIV. If you are more interested in our social media, where we post more things, we're a bit more active on it. On Instagram, where our handle is Grow Proud, one word together. And literally we're on there constantly doing educational sessions just like this Plática. We're on there promoting our HIV testing locations. We're on there talking about our pharmacy prep program. So we're constantly pushing things on social media. If you want to get a hold of me personally and want to maybe have more Plática or just have questions for me and the services and maybe how we can get involved with any of the organizations listening, my email is alejchavez@altamed.org. Maybe you can reach out to y'all. Maybe they can reach out to y'all as well, and you can link them over to me. That's not a problem either. I'm accessible. It's I'm not accessible. So really, I think your best way to get a hold of us would probably be our social media handles. But I think the last thing I would say is, in order to get messages out, it's really important that we're invested in the communities that we live in. If everyone was a little invested in pushing us forward, we would be in a better place. And I think that should encompass everything: mental health, sexual reproductive health, health in general. Those things are important and are not often talked about. So yeah, I feel like asking the questions, putting it out there is the most important things that we can do.
Absolutely, because we need that whole holistic approach that you were talking about, right? I think a lot of times you'll hear me say, like, there's no health without mental health, and help the services that you provide are part of health services, this HIV testing and all of that as well. So, that whole holistic approach, we want to treat the whole person, not just a piece of it. Not just the mental piece of it, not just the physical piece of it, but everything, the person as a whole. Yeah. So thank you for that again, Alejandro. It has been definitely very informational, and I love all the information that you presented to us. Fred?
Well, these pláticas, sometimes they go a little too fast, right? Because we just feel like it's like our 1963 Volkswagen engine finally heated up and it's starting to run smooth, because comienza muy frío, right? It starts all cold. But I'm glad that you were here to help inform, educate, and really bring to light not only the services of the organization, but to really talk very candidly about stigma, and to also be able to bring awareness to the community. But this is Mental Health Awareness Month. It's also Asian Pacific Islander Month too. So, and every month there's always something to commemorate people of different heritage, but it's also an opportunity for us to be informative to the communities that we serve. And so I want to invite the listening audience that was here with us today to say thank you for all of you who are viewing, and for those who will continue to view and comment on the chat in the Facebook page, because we want to encourage you to attend all of our Plática series. And we're going to, of course, every week between now and the end of June, we'll be hosting 2 live Pláticas with different guests and really trying to get the word out about how do we connect people to services. And so even after this plática is over, we encourage you to go home and go say something over dinner, right? When you estás comiendo los taquitos ahí, dices, ¿sabes qué? I heard this today on a plática on my way home. And you know what? I've been meaning to want to say something about this because guess what? We are already thinking about it. We're feeling it. We're just not putting words to it, ¿verdad? Because part of it is that one is it's the family support or our natural support systems that actually help us, encourage us, and actually oftentimes get us to get out and get some assistance and support because healing and helping each other is one of our values and beliefs. So entre nuestra cultura, we practice these things. So I want to say thank you to Ana for co-hosting today's event. Alejandro Chavez, and now that you remind me that you may not publicly be related to Ana, who knows? We'll let you explore that with her and find out, ay, válgame Dios, we have a great grand deal from so-and-so. But the point being is that as a community, we're here to support each other. Thank you for being here with all of us at this Plática. And to all of you who joined us, thank you very much. We want you to continue to put your chats inside the Facebook version when it's recorded, and we look forward to seeing you here. And with that, I want to say thank you very much to all of you who joined us today. Adiós, y ahí nos hablamos. Take care.
Thank you so much. Thanks, everyone.